Hello, this is Miss Bryant, the friendly counselor, and I am back. I know I've been gone for such a long time, but I've still been thinking about everybody out there. And today, as you can see, I'm sitting outside, just kind of relaxing in my hometown, in my backyard, because I want to have a little chat. Normally, I read a book, something like that, but today I want to talk about something that's very serious but necessary. So today I want to talk about mental health awareness, mental health awareness. And so actually that week is coming up and different schools or organizations around the country are doing different things. So you might see them wearing a green ribbon, something like that, or the color green. But two things that they're mainly talking about is removing the stigma and it's okay not to be okay. And so, what does that mean? So, removing the stigma means in the past and even in the most recent present, there are ideas or that aren't necessarily correct that people have about mental health and mental illness. And so people don't go to get help because, oh, that's for crazy people, or oh, I don't want somebody to think something's wrong with me, or oh, some people say that's not for my culture, or it means that I'm weak. However, I am here to tell you today that all of those things are wrong. All of those things are wrong. Just like we go to the doctor and we get checked up and we go to the dentist, we go to the eye doctor for all of those things. Unfortunately, in our history, we have kind of forgotten about another important part of us that is our emotional and mental health. And so now we're trying to make a cultural shift. I've noticed that from people around the world with different seminars and things that I've attended, that they're saying we need to make sure we bring more awareness about our mental health. So, how do you know? What is mental health? Mental health is very connected to your emotional state and your ability to regulate emotions. So, sometimes it's things beyond our control in terms of regulating emotions, and you might need medication. And that doesn't mean that you're crazy. And actually, crazy is not a mental health term. Did you know that? So it doesn't mean that. It just means you needed help. If you broke your leg and it got to the point that your pain was so bad and so excruciating and you couldn't walk, you would probably take something to try to relieve that pain. So sometimes with mental health, we would do the first thing that we would do, like with our leg. We would go and talk to somebody. Go and talk to a professional and say, look, something's wrong here. This hurts too much. And we have to be in touch with our emotions to learn that this is disrupting my life. How do I know if it's disrupting my life? If you have a child or if you are a child, it's disrupting the way your child learns or the way you learn. It's disrupting your relationships at home with your family. And if you're old enough and have a job, it's disrupting your work. It's disrupting your work. And so that means things are out of place. And no matter how you try, you can't seem to do it alone. And that's when you have to let someone know it's okay to not be okay. And you have to talk to someone and say, I'm having a really hard time with this. Sometimes we know why, sometimes we don't. But when we talk to someone and we get help, someone can be a professional. We would prefer that. You talk to a professional. That can be, if you're a person of faith, it can be your pastor or your minister. And then it can also be a mental health professional, a psychologist, a counselor, also a licensed clinical social worker. It can be a mental health professional. Now, one thing I want to say is if you're a person of faith, Going to your pastor and a mental health professional, one does not count out the other. If you go to a mental health professional and you're a person of faith, it doesn't mean you don't have faith. It just means that you went to more places, more resources to get help. So that's one myth. The other thing is there is always someone, somewhere that can listen and help you. But you have to let them know. You have to let them know. I've been having a hard time. Not for just today or 2 days, but it's been a while. But you know what? Some days it's just a day, it's just a moment. So it's okay to talk to a friend and say, today I'm having a hard day. And if someone is talking to you about that, make sure you're listening. Oh, so I see you're having a hard day. Do you want to tell me more about that? And listen to their heart. Listen to their heart because quite often our mind speaks through our heart. So listen through their heart. Listen through your heart. Don't necessarily try to fix it. Oh, you should go do this and you should go do that. But sometimes you may have to say to someone that you love, you may need to go see a professional. And they may respond with fear, but that fear is going to look like anger. I don't want to do that. We don't do that. I am not weak. That's okay. If you know that you have concerns and they need to see a professional, if it's someone you love, tell them. Tell them. Now, how do you know? Some families may say, you know what, I don't really know. If someone is talking about harming themselves or harming others or having thoughts of harming themselves that they cannot control, they need to go see a professional. Does that mean that they'll be locked up somewhere forever? Absolutely not. It just means that, it's okay not to be okay. So, today was just a short conversation about mental health awareness. There are people all over the world speaking thousands of languages that need mental health help, need support. Sometimes the support is for a little while, and sometimes it's long term. But the point is, if you need support, be courageous. If you're afraid, ask someone to go with you and go and get help. There are famous people who have said, I've gotten mental health help and I got therapy. Yes, that's the word I'm using, therapy, and it helped me. Yes, famous people. I remember listening to Michelle and Barack Obama talk about how they got therapy because they needed some support in terms of transitioning and things like that. Yes, you can look it up and find out for yourself. Those of you who've been watching the Olympics may have seen Simone Biles, the phenomenal gymnast, who said, I am not okay and I need some mental health time. And she took it. But you know what? She's still a phenomenal gymnast, even though she did all of that. So that's something we need to think about. There are people who say, I'm not okay. Yes, I'm a professional in whatever field they're in. Mommies, daddies, grandmas, grandpas, cousins, teachers, doctors, lawyers, administrators, the custodian, the lady in the cafeteria, your neighbor, the homeless person on the street that you see. Any of those people, your pastor, your priest, all of those people could need professional help at some time. So, everybody can use help at any time. We talk about our physical health, We talk about exercising, we talk about taking time for yourself. So now let's start the discussion about mental health because our mental health matters just as much as our physical health. So today, just to summarize, remember we are going to say that it's okay not to be okay. And let's bring into conversation and talk about mental health by removing the stigma. Don't make it something to be ashamed of. Make it something to be proud of. Yes, at some point in my life, you could say to your neighbor, maybe to your neighbor, I needed help and I went to get help. And your neighbor may say, you really did that? Say, yes. Make it a conversation that you have like the weather. Let's make it just that common because we have to increase our awareness of mental health. We want to do prevention. So let's talk about it before it gets to such a big crisis that it's totally out of control. So we want to do prevention and decrease intervention. We want to do more prevention. But intervention is there if necessary from a mental health professional. So again, let's remove that stigma. Let's remove the shame. Let's make sure we take care of our mental health as well as our physical health. And remember, it's okay not to be okay. Talk about it. Bye.